Hi, it's Dr. Hizon here talking about Alzheimer's syndrome and the medical informatics that needs to be done for this diagnosis. So please refer to your particular doctor as this is a general course not intended to be medical treatment, and your particular situation may vary. So on the symptoms of Alzheimer's, it's a type of dementia that causes problems with memory, thinking, and behavior. Symptoms usually develop slowly and get worse over time, and they become severe enough to interfere with daily activities. There's disorientation, mood and behavior changes, deepening confusion about events, time and place. It's very challenging for the family. This can involve more serious memory loss, behavioral changes, difficulty speaking, swallowing, and walking, and there is the chance that they can wander. So on the physical exam, the doctor will check the heart, lung, and typically abdomen. We'll assess overall health, but especially focus on the neurologic examination, and then the mental status examination and the questionnaires about that. They usually take a thorough history, physical examination, there's labs, and then usually brain CT scans versus MRIs or magnetic resonant images. And on the treatment, it's usually medications depending on the symptoms. You may get routine brain imaging studies, and then there may be referrals and consultations as indicated. And on the plan, usually it's lifestyle modification, making sure that they do fall precautions as well as keeping the patient safe. There usually are different medications used, sometimes antidepressants like Celexa. They may use other things like Zoloft, Wellbutrin, Cymbalta. These are the typical medicines that the doctor may prescribe. And then there's treatments and therapies. There's usually cognitive training, maybe physical activity treatments for cardiovascular disease, because usually there's comorbidities with these diseases. And then with education, obviously we want to avoid brain injury. We want the patient to challenge themselves, especially mentally, eat a balanced and healthy diet, get quality sleep, maintain good cardiovascular health, and if the medications are prescribed, that they need to be taken as directed, treatments and therapies as prescribed, and follow up with the primary care physician or the specialist as prescribed. So on the chief complaint, usually you ask how many years old the patient is, and also that this patient, male or female, complains of gradual forgetfulness, difficulty concentration, and memory loss for how many months or years. And if needed, you can add more details to that. For the history of the present illness template, a typical one would be such and such year-old male presents today for increasing forgetfulness, difficulty concentrating, and memory loss for the length of time in months or years. And then we look at the date of onset, the context, like when does this happen, and then the past medical history, social history, family history, especially if there's any family history of health disorders, mental health disorders, and or depression. And then for the symptoms, say out of 10, how bad are the symptoms both at rest and with activities? And do they interfere or prevent daily activities? And the memory loss that disrupts daily life, what are the challenges in planning and solving, and any particulars that may go along with the patient. Also, the timing and duration, is it a constant situation or is it intermittent? And are there associated symptoms or conditions such as visual changes, decrease or poor judgment, changes in mood or personality, chronic illnesses or pain? And then provocation is like what makes it worse, and then also what makes it better in alleviation. And as you continue on the healthcare, the history of the present illness template, you'll also want to make sure that you look at changes in sleep pattern, and then is there recent stress in their life? Do they have recent problems with forgetfulness, numbness, and if so, where is it in the arms or the legs? Do they have any other symptoms such as pounding the chest with a rapid heart rate? Do they have mood or behavioral changes? And then in the past medical history, have they had a history of stroke or Parkinson or diabetes? Have they had head injuries or heart disease or diabetes? And then how have they been treated so far? What medications, what therapies? What workup have they had? Have they had a physical exam, labs? Have they seen a neurologist? Have they seen a psychiatrist? And you can do these at either negative or plus minus, or add in details. On a past medical family social history, you'll look at history of depression and or mental health disorder, tobacco use, what are they doing in terms of exercise, nutrition, and sleep program. And on the review of systems, constitutional especially, have they had any change in their weight, and then go through the rest of the review of systems. And on the objective part of the template, usually it starts off with a general description of the alert, male or female, in what kind of distress, and is there evidence of that distress. On cardiovascular, do they have regular rate and rhythm? That's what RRR stands for. Do they have any sort of abnormal heart sounds? And are their peripheral pulses intact? On the respiratory, do they have bilateral clear to auscultation breath sounds? Do they have any other kinds of abnormal breath sounds? And neurologically, do they have normal cranial nerves, strength, sensation, reflexes, cerebellar signs? And if in doubt, do more exams than less. Psychiatrically, they'll look at speech. Is it a normal rate, rhythm, and tone? Or their thought process normal, or are they tangential? And then in the content, do they have SI, meaning suicide ideation, or HI for homicidal ideation? Do they have psychotic symptoms, attention problems or concentration problems, and other judgment or insight problems? And on the past medical family social history, do they have family history of the depression or mental health? Do they use tobacco? Let's see. We already did that. So on the assessment, usually there's a decision. Is it a simple, complicated, or a very difficult case? Does it require straightforward thinking, or is there a complex decision? And then what are the treatment options given? And usually this is where the provider or physician will give the reasons for their thoughts on the diagnosis and what the rationale is for the treatment. In terms of the diagnosis, these are the typical ICD-10 codes you'll use. G30 is Alzheimer's disease. G30.0 is Alzheimer's disease with early onset. G30.9 is Alzheimer's disease unspecified. And then F02.81 is dementia in other disease classified elsewhere with behavioral disturbances. And on the plan, there's usually medications, there's therapy as prescribed, specialty consultation, and maybe a follow-up with their primary care physician or specialty provider. And in terms of the pearls and pitfalls, if they have any symptoms of one side or the other, get the correct affected side correct in terms of left or right. Be sure to document all the symptoms and duration, the past medical history of chronic diseases, trauma, losses, or other stressors, their past mental health disorders, any sort of family history of neurologic or mental health disorders. Learn the various questions to ask during the HPI and the physical exam. And then please ask the doctor if you have any questions about the evaluation of Alzheimer's for the documentation. And in primary care, ask about quality measures, especially screening tests. So takeaway points is that Alzheimer's is the most common underlying cause of dementia and symptoms. Treatment requires patient's family and caregiver cooperation and compliance. Diagnosis depends on detailed symptoms and accurate history of the present illness. It is important to rule out any differential diagnosis. And the key is for you as an informatics specialist to study hard to learn the various questions to ask, such as an accurate history of the present illness and exam, and learn the required mental health questionnaires to assist the provider. And again, we thank you for your service, because as doctors save lives, medical informatics specialists save doctors. Thank you.